Welcome to this special PlacidWay Pulse edition of our deep dive. Our whole mission here is to help you understand medical travel options around the world. And we really try to do that in a simple, honest, and practical way.
Yeah, absolutely. And I mean, if you were listening to this and you've ever felt just totally overwhelmed by this staggering cost of healthcare at home, or maybe you're defeated by those endless wait times for specialized treatments, you are exactly where you need to be today.
Right. Because today, the topic of this deep dive is advanced stem cell therapy in Slovakia. We're specifically looking at why so many patients from the US, the UK, and the DACH region, so Germany, Austria, and Switzerland, are literally packing their bags for the CellCenter Institute of Regenerative Medicine.
Yeah, it's a massive shift. And we need to have a real talk moment about this. For a lot of people dealing with severe, degenerative conditions, stem cell treatment is not some luxury wellness retreat.
No, not at all.
It's about regaining basic mobility or managing really terrifying neurological conditions, or, honestly, just finding a way to live without chronic daily pain.
Exactly. But then you get that local sticker shock, and it just makes it feel completely out of reach. It really feels like local healthcare has become this premium subscription service that just keeps raising its rates while cutting its benefits. Like, you're paying top dollar, but you are still just stuck in the waiting room.
That is a perfect analogy because the struggle in places like the US or the UK is real. If a
Yeah.
patient is facing a complex, progressive disease like ALS, for example,
Yeah.
they're dealing with massive bureaucratic red tape.
Yeah.
They end up waiting years for these cutting-edge regenerative treatments to get approved locally.
Hmm.
And economically, it's just brutal. In the US, orthopedic stem cell therapies for a bad knee can run anywhere from $15,000 to over $25,000.
Wow. Just for a knee.
Just for a knee. And if you're looking at neurological treatments, those can soar up to $45,000, all out of pocket.
Which is just, it's impossible for the average person. Which brings us to the European alternative. And I want to emphasize that it's not just about a cheaper price tag, it's about immediate access. For European patients, it's literally a short train ride or a quick flight, and the overall package value is just immense.
Right, because I think it's human nature to ask, how much does it cost?
Right.
That's everyone's first instinct.
Of course.
But the smarter question, the one you really need to be asking is, what am I actually getting for that price?
Okay, let's unpack this right here. Because people hear medical travel, and they immediately assume that crossing a border means you are taking a dangerous medical shortcut just to save the buck. How is this actually safer than just waiting it out at home?
It's a fair question, but it's based on a big misconception. In Slovakia, patients are saving, 40 to 60%. But they aren't doing that by cutting corners in the lab. They are tapping into a completely different economic healthcare model. Slovakia is part of the European Union. They operate under incredibly strict EU medical directives. The savings come from lower administrative overhead, different real estate costs, and malpractice insurance structures, not from using cheap, unsafe equipment.
So the medicine is the same or even better,
Yeah.
but the business model around it is just way more efficient.
Exactly.
Let's talk about the destination context then. Slovakia is really emerging as this medical hub. We are looking at Bratislava and Malacky, and these aren't just places with a couple of pop-up clinics. They have built real state-of-the-art infrastructure specifically designed for medical travelers.
Yeah, and the CellCenter difference is a perfect example of this. The setup they have in Malacky is unique because the clinic is located directly within a hospital building.
Which seems like a no-brainer, but it's actually not that common, is it?
No, it's really not. A lot of private clinics around the world are just in commercial office buildings. But being inside a hospital provides this ultimate safety net. You get the privacy and the advanced cellular therapy, but you also have the security of a full-scale emergency medical infrastructure right outside the door.
So if anything goes wrong, you aren't waiting for an ambulance to find a strip mall. You are already in a hospital.
Exactly. It's a huge peace of mind factor.
And the team running this place, the multidisciplinary dream team they have, is super interesting. You've got the medical director, who has over 30 years of experience. He's a former deputy chief physician at the Ministry of Defense Hospital. So he brings this military-grade triage and strict surgical discipline to the table.
Yeah, the precision is unmatched.
And then he is partnered with a specialist who holds a Master of Public Health and an MBA. So someone who blends clinical practice with public health and business administration to manage the international patient experience. Here's where it gets really interesting to me. You have a military surgeon teaming up with a public health and business expert. It's like taking the tactical precision of a special ops unit and dropping it into a five-star hospitality experience.
That's a great way to put it. And what's fascinating here is how this team operates the lab.
Yeah.
They utilize high-tech German engineering, specifically these closed system centrifugation units.
Okay, break that down for me. What does a closed system actually mean?
So it means the biological material is drawn from the patient, processed and concentrated entirely within a sealed loop. It never touches the open air in the laboratory.
Oh, wow.
Yeah, so it isolates and concentrates the mesenchymal stem cells, or MSCs, ensuring the absolute highest viability. And because it's a closed loop, it basically eliminates the risk of synthetic contamination or airborne pathogens.
Okay, let's pivot to the actual journey, the how and the what, because I think the logistics can feel really overwhelming for people. But if we break it down, it's just a series of steps. It starts with your own research, reaching out to a guide like PlacidWay, reviewing tailored options, having virtual consults with the doctors, and then finally booking the trip.
Right, but during that research phase, you really have to look past the marketing fluff. You have to know exactly what to compare.
And we aren't just talking about glossy brochures or generic global badges here.
No, you have to look at local healthcare licensing and governmental certifications. This is crucial. For instance, in Slovakia, there is a strict legal requirement for a role called the Professional Expert Guarantor.
Which the medical director at CellCenter holds, right?
Exactly. And that title means he is legally accountable for ensuring that all human tissues are handled to those rigorous EU safety standards. It's a huge green flag.
Okay, what does this all mean when you were sitting there staring at 3 different clinic websites? How do you actually verify these local EU licenses from your couch at home?
This is where direct communication comes in. You get on that virtual consult and you ask for the specific credentials of their expert guarantor. That question alone separates the world-class clinics from the discount bin operations. You also want to ask if they have ISO-certified clean rooms, and make sure the doctors speak your language fluently. Fluent English and German are standard at CellCenter, which takes a lot of the stress away.
And we also need to talk about transparent pricing details, because you need to know what is actually in these packages. The data shows an autism package priced at $8,300, and that includes the lab preparation and both IV and nasal administration of the cells.
Yeah, and that nasal administration is key.
Wait, really? Why through the nose?
Because it bypasses the blood-brain barrier. When you do an IV, the blood-brain barrier filters a lot out. But administering it nasally allows the cells to travel directly along the olfactory nerve pathways into the brain.
Oh, that makes so much sense. But you also have to know what is excluded, right? Like that package doesn't cover your airfare, your hotel stays, or your personal meals.
Exactly. Transparency is knowing both the inclusions and the exclusions up front.
To bring all this data to life, let's talk about Beatrice. She's a real person, a patient from Zurich, Switzerland. And she was suffering from severe knee osteoarthritis. She was basically told she needed invasive surgery.
Which is a terrible position to be in.
Right. So she goes to a private Swiss clinic to look into autologous knee stem cell therapy, and she gets handed a bill ranging from $15,000 to $25,000.
Just massive sticker shock.
Totally overwhelmed. But instead of just giving up, Beatrice took control. She reached out to PlacidWay. She didn't just book the first glossy ad she saw on Google. She actually learned how to compare the real credentials of the doctors.
Yeah, she evaluated the medical director's background. And she specifically looked to the fact that CellCenter utilized image-guided ultrasound injections.
Which is super important for precise cellular delivery, right?
Absolutely. You don't want someone just guessing where the damaged cartilage is. Real-time ultrasound means the stem cells are delivered exactly to the microfissures in the joint.
So Beatrice does her homework, travels to Slovakia, and she ends up paying between $4,200 and $5,500. And she got this treatment in an unhurried, deeply personalized environment. It really feels like treating your body like a vintage high-end car. You wouldn't just drop it off at the cheapest mechanic you could find on a highway billboard. You would interview the engine builder. Beatrice interviewed her engine builder.
That is exactly right. Beatrice's success wasn't just about the money she saved, though that was significant. It was about her empowerment. She asked the hard questions. She asked about the follow-up care. And she asked about the exact type of cells being used, making sure they were MSCs.
But we do need to offer a balanced view here, because medical travel is not a magic wand for every single person.
Huh?
There are pros and cons.
Absolutely.
On the pro side, you have massive cost savings up to 65% on some of these neurological therapies. You get comprehensive packages that include adjunctive therapies like IV infusions and hyperbaric oxygen therapy or HBOT, and you get those strict EU safety standards.
But the cons are real, too. You have the logistical hurdles of traveling, which is exhausting, especially if you are managing a degenerative disease. You have the out-of-pocket travel cost. You're away from the comfort of your own home. And you have the need for remote follow-up coordination.
It's a lot to manage. So to help listeners, we put together this essential checklist. These are rapid-fire questions you must ask any clinic. First, am I a good candidate for this specific treatment? Like, are you free of active severe infections or aggressive cancers?
Right, because a good clinic will turn you down if you aren't a safe candidate.
Second, what local licenses and board certifications do the doctor and the clinic hold? Third, what exactly is included in this quote and what will cost extra? Fourth, who is my point of contact for follow-up care? And fifth, what is the realistic recovery time before I can fly home?
That last one is huge. Usually it's about 3 to 4 days for these minimally invasive procedures.
But wait, if I get an IV stem cell infusion on a Tuesday, am I really okay to jump on a commercial flight back to London or Berlin on a Thursday?
I get why that sounds fast. But if we connect this to the bigger picture, the immediate physical recovery from the actual procedure, the injection itself, is typically just a few days.
Yeah.
That is what clears you to handle the physical stress of travel safely.
Oh, I see.
Yeah. The actual biological tissue regeneration, the cartilage rebuilding, or the neural pathways repairing, that takes 3 to 6 months to fully manifest inside your body.
So you heal enough to fly quickly, but the real magic takes months.
Exactly.
That makes a lot of sense. And, navigating all these complex medical, logistical, and financial questions is exactly why PlacidWay exists. They don't make the medical decisions for you. They act as your dedicated guide. They connect you with verified international providers like CellCenter. They help you compare destinations, and they really just organize the chaos so you can make an empowered, confident choice.
It takes the burden of the logistics off your shoulders so you can focus on your healing.
Exactly. Thank you so much for listening to this deep dive on PlacidWay Pulse. Remember, if you are exploring stem cell therapy or any other medical travel options, take your time, ask the hard questions, and use PlacidWay Medical Tourism to help you compare options with more confidence. You can visit PlacidWay.com to start exploring today.
And I want to leave you with one final thing to mull over. Stem cell therapy is fundamentally shifting medicine away from just masking symptoms with pharmaceuticals and moving toward targeting the cellular root causes of our decline. If we can harness our own biology to regenerate cartilage and repair neural pathways in a clinic in Slovakia today, what does that mean for the whole concept of aging in the next 10 years? Are we approaching a future where our own bodies become our most powerful medicine?